Water-soluble vitamins. The water-soluble vitamins are vitamin C or ascorbic acid and B-complex vitamins. Vitamin C is the most easily destroyed for all the vitamins. It is the fresh foods vitamin since it occurs in growing parts of the plants. All raw fresh fruits and vegetables contain ascorbic acid in varying amounts. Vitamin C is involved in a number of biological roles as well on the food as antioxidants. Ascorbic acid. Vitamin C or ascorbic acid is known as anti-scorbutic vitamin because it prevents the national disease scurvy. The most active forms are L-ascorbic acid and L-dehydroascorbic acid. Vitamin C is needed in the formation and maintenance of intercellular cementing substance, which is binder that holds cells as well as the cellular fluid, which bathes and nourishes them. It is also essential to the normal function of cellular units, including ribosomes and mitochondria. As antioxidants vitamin, it protects normal cells from the damage of free radicals and other substances by oxidation. Vitamin C is the most unstable of all vitamins and is most easily dissolved in the water. It is easily destroyed by heat, acid, alkali, light, and oxygen. Vitamin C is almost completely absorbed in the small intestine except in cases of aclohydria and gastronomical disorders. The best animal sources are cheese, milk, eggs, liver, and other granular organs and lean meats. Niacin. The two forms of niacins that are biological active are niacin or nicotinic acid and its amide form, called niacinamide or nicotinamide. The unit of measurement for niacin is milligram equivalent, which includes all nutritionally active forms of niacin, including tryptophan, conversion to niacin. An average of 60 mg dietary tryptophan is equivalent to 1 mg niacin. Niacins act as hydrogen and electron acceptors. A biochemical reaction is important in energy metabolism, fatty acid synthesis, and protein synthesis. Niacin is also needed for photosynthesis in plants and carbon dioxide fixation in animal cells. Niacin is the most stable of the water-soluble vitamins. It's circulated in the blood both in acid and amide forms. It is stored in tissues in limited amounts depending on tissue depletion or saturation. The deficiency signs and symptoms of niacin are closely parallel to those of riboflavin, since these two are interrelated with tissue metabolism. The early signs of niacin deficiency are anorexia, lassitude, and indigestion and skin changes. Studies with the human requirements indicated a minimum level of 4.4 mg by 1000 kilocalorie. Age, growth, body size, illness, lactation, surgery, and increased physical activity, which are all functions of energy requirement, also increase in niacin. Excellent food sources for niacin are the same for protein sources. Outstanding are animal sources, namely liver, granular organs, lean meats, fish and poultry, milk and cheese, eggs, legumes, and peanut butter. Pyridoxine or vitamin B6. Pyridoxine is a group name for three forms: pyridoxal, alcohol form, pyridoxyl aldehyde form, and pyrosamine, amine form. Vitamin B6 group is measured in milligrams or micrograms. All three forms converted to active coenzyme factor pyridoxal phosphate, which is involved in amino acid metabolism. Vitamin B6 groups play a big role in metabolic reactions. It also catalyzes urea production, synthesis of essential fatty acids, and conversion of niacin from tryptophan. Pyridoxine regulates the metabolism of homocysteine in metabolite associated with coronary heart disease. Pyridoxine is readily absorbed in intestine and is circulated in blood as active coenzyme. No deficiency state has been observed in adult man by dietary depletion. Induced experimental deficiency by injecting an antagonist results in nausea and vomiting, etc. Infants who were deficient in pyridoxine, which resulted from feeding them milk formulae lacking in pyridoxine for several weeks, cause irritability, poor growth, and anemia. Pyridoxine intake should parallel protein requirements. The RDA for USA is 2 mg. Pyridoxine a day for adults. Common foods with the highest pyridoxine contents are liver and granular organs, eggs, pork, fish, poultry, legumes, whole grains, and bran cereals.
So other parts of water-soluble vitamins are pantothenic acid and cobalamin. So let's go first to pantothenic acid. This pantothenic acid has another name called as chick antidermatitis factor. Pantothenic acid is also called as vitamin B5. The name pantothenic acid is derived from the Greek word pantothen, meaning from everywhere, and it gives an indication of the wide distribution of the vitamin in foods. Now let's go to the functions of pantothenic acid. A pantothenic acid is needed for active acetate or acetylation reactions, oxidation of keto acids and fatty acids, synthesis of lipids, acetylcholine, and porphyrin ring. Therefore, pantothenic acid is essential for carbohydrate, protein, and fat metabolism, as well as for the maintenance of normal growth, beauty, skin, and integrity of the central nervous system. So the utilization of pantothenic acid. Pantothenic acid is readily absorbed in the small intestine. It is stored to a limited extent in the liver and kidney. It also occurs in the blood and tissues to bound form. Now let's proceed to deficiency manifestation of pantothenic acid. So no clear-cut case of pantothenic acid deficiency has been reported. Clinical signs observed in experimentally induced deficiencies are paresthesia or abnormal tingling sensation, headache, dizziness, gastrointestinal malfunction. One syndrome which is associated with pantothenic acid deficiency is Gopalan's burning foot syndrome, which is manifested as paresthesia, that is burning or lightning pain in lower extremities and staggering gait. The syndrome is seen during famine, in prison camps, in chronic alcoholics, and in renal dialysis patients. In daily requirements, adults require approximately 5 to 12 milligrams per day, whereas infants 1 to 2 milligrams and in children 4 to 5 milligrams per day. The dietary sources of pantothenic acid are eggs, liver, yeast, wheat, germs, and cereals, etc. They are the important sources of pantothenic acid, although the vitamin is widely distributed in nature. So other parts of water-soluble vitamin is the cobalamin or vitamin B12. So the name and measurements of cobalamin. The cobalamins are generic group of B vitamins with cobalt in its chemical composition. Several forms exist, namely cyano, hydroxy, and nitrosocobalamins. Cyanocobalamin is the most active biologically. Cobalamins are bound to occur in animal protein foods. Now let's go to the functions of vitamin B12. First is the transfer of methyl groups in nucleic acid synthesis. Then we have vitamin B12 affecting the formation of myelin. We have the deficiency of vitamin B12, so it leads to either megaloblastic anemia, glossitis, hypospermia, and GI symptoms or gastrointestinal manifestation. The recommended daily amount intake of B12 is 2.4 micrograms. For instance, 2 servings of milk per day provides 2.4 micrograms of B12. If you're eating a balanced diet for all the food groups, you're likely getting the required intake of B12. Now let's go to the last part of the cobalamin, which is the food sources. In general, animal proteins contain B12 significant amounts, while plant sources are practically nil or zero. Thus, deficiencies of B12 have been observed in strict vegans. Otherwise, an ordinary mixed diet using your food pyramid to ensure nutritional adequacy should contain sufficient amounts of cobalamin.
Thiamine. Thiamine is one of the vitamin B vitamins. Thiamine helps to turn food into energy to keep the nervous system healthy. Other names for thiamine. The preferred spelling for thiamine is without the ending E. It is also known as vitamin B1. Measurements. The unit of measurement is in milligrams or in micrograms. Functions. These vitamins plays a critical role in the energy metabolism and therefore in growth, development, and functions of cells. Daily requirements. For adult, 1.0 to 1.5 milligrams, and for children, 0.4 to 1.3 milligrams. Food sources. It can be found in cereals, grains, beans, and meat.
Riboflavin is the official name of vitamin B2, which is the traditional name of this vitamin. The ribo in riboflavin means ribose, which is a pentose sugar, and flavin refers to its yellow content. Side note, an oxidized flavin is yellow and a reduced flavin is colorless, in case you get confused. Riboflavin is the only water-soluble vitamin used as a food coloring because of its color. This water-soluble vitamin has a solubility in water that is poorer than other vitamin Bs. Riboflavin is a vitamin that is needed for growth and overall good health. It helps the body break down carbohydrates, proteins, and fats to produce energy. This vitamin and it allows oxygen to be used by the body. This vitamin is measured in terms of milligrams and micrograms. So what are the functions of riboflavin? Riboflavin is involved in many body processes. It's required for the proper development of the skin, lining of the digestive tract, blood cells, and brain function. As an antioxidant, riboflavin has the potential to reduce oxidative stress in your body, including your eyes. In particular, scientists are studying riboflavin's potential to prevent cataracts, as prolonged riboflavin deficiency may lead to this condition. Interestingly, many individuals with cataracts also are deficient in this antioxidant. One study found a 31 to 51% decreased risk of cataracts development when participants get diets included 1.6 to 2.2 mg of riboflavin per day compared to 0.08 mg per day. Riboflavin is also needed to help the body change vitamin B6 and folate into forms it can use. It is also important for growth and red blood cell production. Most healthy people who eat a well-balanced diet get enough riboflavin. However, elderly people and alcoholics may be at risk for riboflavin deficiency because of poor diet. Symptoms of riboflavin deficiency include fatigue, slowed growth, digestive problems, cracks and sores around the corners of the mouth, swollen magenta-colored tongue, eye fatigue, swelling and soreness of the throat, sensitivity to light. Early signs of deficiency to this vitamin is similar to thiamine, but the advanced deficiency of this is called araboflavinosis. So what is araboflavinosis? Araboflavinosis is caused by deficiency of vitamin B2. Certain groups of people are at a greater risk of being deficient in riboflavin. They are individuals with kidney disease who are being treated with dialysis, individuals with absorption problems, women who are pregnant with more than one fetus, women breastfeeding more than one infant, people with other vitamin deficiencies and protein, energy, and malnutrition. These are the following people that are usually deficient in riboflavin and may need extra vitamin B2 from supplements. Women who are pregnant or breastfeeding, anyone with inadequate caloric or nutritional dietary intake or increased nutritional requirements, athletes, those who drink alcohol in excess, people who have just undergone surgery, those under long-term excess stress, impaired liver function, which prevents proper utilization of the vitamins Other symptoms of riboflavinosis. True riboflavin deficiency is quite rare. When riboflavin deficiency symptoms do occur, they are usually related to a shortage of all the vitamin Bs. Usually, though riboflavin deficiency shows up as problems with mucous membranes, skin, eyes, and blood, and early clear signs is sores and cracks on the corners of the mouth. Scaly skin, reddened eyes, and anemia are other deficiency signs. These are the other symptoms of riboflavinosis. Sore lips or throat, redness and swelling of the mouth and throat, cracking of the lips or cheilosis, inflammation and cracks on the corners of the mouth or angular stomatitis, tongue redness and inflammation or glossitis, itching and scaling of skin, particularly affecting the scrotum or vulva and skin around nose, mouth, forehead, ears, scalp, and lips. Formation of blood vessels on the cornea or the clear part of the eye, blood disorders such as anemia, eyes overly sensitive to light and easily tired, trembling, and insomnia. So what are the prevention and treatment for riboflavinosis or deficiency of riboflavin? Treatment involves diet high in sources of vitamin B12. Normally, people may get required riboflavin from the following source like beef liver, dairy products, eggs, meat, wheat germ, and tuna fish. The most nutrient-dense sources of riboflavin are liver, mushrooms, spinach, and other green leafy vegetables, broccoli, asparagus, and milk products. Supplements can be used to increase the amount of B2 consumed. However, should be only for prescription. This is the recommended energy and nutrient intakes per day. In the riboflavin section, you can see that every age group have different requirements in riboflavin, from infants up to the lactating women.
Biotin. So biotin is a water-soluble vitamin that helps the body metabolize fats, carbohydrates, and protein. Because water-soluble vitamins can be stored in the body, they must be consumed on a daily basis. So name and measurement, biotin is sometimes called the anti-egg white injury factors because egg white contains a protein called avidin, which combines with biotin in the intestinal tract and prevents absorption of biotin from the intestine. Obsolete name for it are vitamin H, coenzyme R, and VIAS2. It is measured in micrograms and it has been called the micronutrient. So function, the chief roles of biotin is as coenzyme factor in carbon dioxide fixation. Together with active acetate, it helps in the synthesis of purines, pyrimidines, fatty acid, and carbonylation reaction. So utilization. When compared to other B vitamins, biotin isn't as readily absorbed because it bonds to protein in foods and is digested. Avidin, a raw egg white protein, binds to biotin and renders it inactive. So biotin isn't synthesized much in the intestine. Malnutrition through biotin deficiencies does not occur even in a poor diet. In rat feeds with birds amounts of raw egg whites, deficiency signs are spectacle eyes, alopecia, gray scaly dermatitis, and paralysis of hind legs. So biotinidase deficiencies is quite rare. It is an autosomal recessive disorder in which biotin cannot be cleaved from peptides and recycled. So biotin deficient children have delayed growth and development, exhibit hearing loss, ataxia, seizure, coma, and even death. No toxic effect of excessive biotin have been observed in man. Requirements or allowance. The small amount of biotin required for psychology makes it difficult to determine requirements. Biotin is also generated by numerous colonic flora which contribute to the supply of biotin available to people. The DRRS in USA for biotin are 5 to 12 mg per day for infants and children, 20 to 25 mg for adolescents, and 30 mg per day for adults. So food sources. Excellent food sources are liver and other glandular organs, meat, egg yolk, milk, molasses, whole grain legumes, and nuts. So because biotin is micronutrient dietary, there is no problem in planning for adequate biotic intake. So choline. Choline is an organic compound classified as water-soluble essential nutrient and usually grouped within the vitamin B complex. It is required for normal bodily function and human health too. Your liver can make small amounts. You must obtain the majority through your diet. So function, choline is the major source of metal group in the diet. Its metabolism is closely related to that of folate and methionine as metal donors. So choline chemical formula is this, where X is a quaternion such as chloride, hydroxide, or tartrate. Malnutrition. Deficiencies of choline result only if protein intake is inadequate. Choline synthesized from methionine. So there is no harm in human when choline is produced from methionine. Requirements or allowance. The American Academy of Pediatrics Committee on Nutrition recommends that baby formula contain at least 7 milligrams of choline per 100 calories. So food sources. The richest food sources of choline is egg yolk. Other good sources are liver, bee kidney, brain, meats, legumes, and nuts, yes, and wheat grain. The last two are supplements or ingredients rather than common foods.
Inositol. Known as a chemical substance for many years, it was only in 1940 when investigators started to consider it as a vitamin. The common form is a myo-inositol and the only form utilized by the body. It is presented in many foods like cereal, legumes, nuts, fruits, vegetables, and it is closely associated with dietary fiber. Its structure is closely similar to glucose, hence the other name for its muscle sugar. Other vitamins like factors. Some food substances have a vitamin-like function, but they still have to satisfy the other criteria for track vitamins. As explained under Chapter 11, these are taurine, leupic acid, ubiquinone, bioflavonoids, and carnitine. Taurine is similar to an amino acids, but it occurs freely and not in a peptide linkage. Recent studies demonstrated a role in the regulation of brain and function. There is needed for further studies on this substance before it can be considered as essential nutrient. In 1984, taurine was first added to infant formulas and was named Allen Sparagen. So, all we know that amino acids are molecules that combine to form protein. Amino acid and protons are the building blocks of life. So, dietary source. Taurine is found in fish, oil, and meats in high quantities from 30 to 170 milligrams per 3 ounce serving, and it is not found in diet of strict vegetarians. Infant formulas including soy protein based infant formula are now supplemented with taurine to provide concentration similar to that human milk. So function. First, component of bile acids. Second is regulator for heartbeat. And the third is maintain membrane stabilization and is active in all tissues with electrophysical potential. Number 4 is depressor effect on brain neurons. Number 5 is serve as a protective role within cell plexus, which prevent free radical formation and prevent possible membrane peroxidation. And number 6 is important for optimal retinal development and function.
Lipoic acid. This is a sulfur-containing fatty acid, and it's not a true vitamin because it can be synthesized in adequate amounts in the body. However, it is unlike the other vitamins, a coenzyme factor. Together with TPP, thiamine pyrophosphate, lipoic acid is a coenzyme for energy metabolism, converting pyruvic acid to acetyl. There is no set requirements for lipoic acid as yet for human beings, although its biological role indefinitely known. The concentrated sources of lipoic acid are yeast and liver.
Carnitine. Carnitine is produced by the body in the liver and kidneys and stored in the skeletal muscles, heart, brain, and sperm. It is essential for transporting long-chain fatty acids across the mitochondrial membrane for subsequent fat breakdown and energy production. The acetyl derivative of carnitine, or ALC, is found throughout the central nervous system. It is known to benefit weight management, mental function, and lessen fatigue.
Conclusion: more studies are needed to establish the essentiality of this vitamin, like factors in aeration. Currently, the focus of interest about these compounds is about their therapeutic uses. It is not surprising if more vitamins will be added to our present list after more intensive researches show positive results.